facing our fears, laughing through the chaos and drinking some beers. So here's to the laughs, the crumbs and the cheers, all the awkward moments, and we're still here. Cause in the end we're just doing our thing. It's our crazy life, oh, one more thing. One more thing. Oh!
Hi, I'm Brian. Welcome to Oh, and One More Thing.
Hey everyone, I am Rob. How we doing?
I'm doing great, Rob.
Yeah, so Brian, what hurts today?
The question really should be, what doesn't hurt today, Rob?
It's very true. It's very true. I'm actually feeling a little bit under the weather.
Are you?
Maybe you can hear it in my voice a little bit. I'm a little nasally. I've had a cold for a few days.
Yeah, that's terrible.
I know. Typical symptoms, stuffy nose, sore throat, watery eyes. I mean, clearly I'm dying.
Clearly you are.
Yes.
That's funny, though, because I always Google my symptoms and self-diagnose. I mean, who doesn't?
Oh, right.
I know I'm not a doctor or a nurse, but...
Yeah, I know what you mean. But let's be honest. I mean, as a guy, like when I come down with anything, like I can't function. I mean,
No, you can't.
I mean, seriously.
I know that.
Yes, so does my wife. But good thing I personally know a medical professional. In fact, my stepdaughter is an ER nurse. Did you know that?
I did know that.
Yeah, I should ask her. Hey, Nurse Nikki, am I dying?
No.
Thanks.
Perfect timing, Nikki.
Right. Hey, everyone. Today we're excited to have our special guest on, who is none other than our very own Nurse Nikki.
Woo-hoo. Hi, peeps.
Hi.
Hey.
We're glad you're here. What's going on?
Not much, just hanging out.
Well, tell us a little bit about yourself.
Well, I'm a nurse practitioner over in the ER in South Dakota in a rural area.
Okay. So explain what a nurse practitioner is and does.
So I went to undergrad and I was a RN, so Bachelor of RN, so registered nurse. And then I went to graduate school, so a master's degree for a nurse practitioner. So do you guys know what like a PA or physician's assistant is?
Right, yeah, I know that.
Mm-hmm.
Yeah. So kind of like the same level. So we're considered advanced practice providers. So
Okay.
we're mid-level.
Okay.
So you have doctor, and then you have NP, APPs, PAs, and then you have like nurses.
Okay.
So,
But most importantly, you can prescribe drugs.
yes.
Okay, cool.
All the drugs.
Oh, we'll talk later. So how long have you been an ER nurse, I guess?
Or ERNP.
NP,
Because
sorry.
there's a difference.
How long have you been an ER NP?
So that'll be 3 years in July.
Okay.
So I consider myself a baby in
But
the
still
field.
new in the
Yes.
field.
Yes.
Okay.
So until you're like 5-6 years into whatever field you're in, you're still very much new.
Okay. Well, we won't put you through the ringer too much today, but we want to learn a lot about the ER.
Yeah, and I want to know like your actual title. Like it's like on your business card. It's not just
Like all my
it's
titles.
It's not just Nurse Nikki. Like what is it?
No, so like because we always have our RN, so
Yeah.
I always have that. So I have my BSN RN,
Okay.
and then I have my FNP, which is my family nurse practitioner.
Okay.
MSN, Masters of Science in Nursing.
Okay.
And then my license, which is like the APRN, so Advanced Practice Registered Nurse.
Oh, good Lord.
So I can have like
You have like the whole alphabet behind your name.
yeah, and I can get more.
Really?
Yes.
So the whole card fills up with just letters.
Yes. But then you have like commas in between, so you know to delineate like this and this. And this.
It is impressive. But now what I really want to know is, does it say Nurse Nikki?
No, I actually brought my badge and it says nurse practitioner. Oh. But it says my full name and I don't like that.
Yeah.
I don't like
well.
my government name.
You're
It's
stuck
the way
with
it is.
Yeah. So you said you can do more. Like what else would you do?
So like I could go get like a doctorate if
Okay.
I want. I
Right.
could go get a PhD.
Okay.
Otherwise I could specialize. So like right now I'm doing classes to specialize in emergency medicine.
Mm-hmm.
So if I get that certificate, that'll also be added on to all of my letters.
But in order to do that, you would have to take like an organic chemistry class, right?
No,
No, you don't?
no. I have to get to bypass that.
Oh, I've heard
if
that-
I want to go back to medical school, I have to take that.
Yeah, I've heard from numerous people that class is horrendous.
Yeah,
Yeah,
no. I
tough.
bet been there, done that.
Yeah,
That's
you-
why I switched.
Yeah,
So
right.
So if you get your doctorate,
yes.
then does that make you, what does that make you? A nurse doctor? Doctor nurse?
Nope. So it's a big
I don't
point
get
of
this.
contention.
I don't understand.
Doctor nurse.
What is it?
It's a big point of contention in the medical field, actually.
Is it?
Yes.
Oh, do tell.
So, well, because doctors or physicians are MD.
Yeah.
So they go through all of that schooling, way more schooling than I have. And so they have that degree. And so if we get a doctorate, we still go through. So if you get a doctorate in nursing, you're looking at least 4 years for your bachelor's, probably another 4 to 6 years for your doctorate. So
Sure.
anywhere from 8 to 10 years. So you
Okay.
do a lot of schooling, but it's not the same. It's
It's a doctorate in your
in my field in nursing because
Okay.
we are trained different
Sure.
than a doctor,
I got it. Okay.
than like an MD.
Well, good. Thanks for clearing that up. I've always wondered that.
Yes. So it's a doctorate, yes, in my field of nursing.
Okay.
So
Got it.
So you would or not be called Dr. Nurse Nikki.
no.
Well, we would totally call you Dr. Nurse
totally.
Nikki.
Like that's totally fine. But yeah, no.
So we're going to just fire some questions at you and we'll just see where it goes. Okay. Does that work out?
Go for it.
Okay. Awesome. So here's the first one. Can you tell us a little bit about what goes on in a typical day in the ER?
So it depends. So my shifts, I do usually 24-hour shifts. So
What?
I start at
How
7.
can you do 24? I can't stay up 24 hours.
Oh yeah.
I'm old though.
I just did it.
No, this body, are you looking at me? I can't stay up
You're like,
24.
you're like, absolutely not. Dude, I have nurses that are older than you that do it.
Okay, well, we'll talk about that later.
There's a lot of other issues involved with this one.
There's a
over
lot
here,
of
so I-
issues.
yeah.
We're covering off on all the issues through every podcast.
Okay. You need your 10 hours of sleep. You need your sleep mask, all of that, right?
Sure.
Okay.
I don't have a sleep mask.
No, I'm going to debate that comment because during our show choir days, when we were trailer dads, we had 24-hour days.
I know, and actually I loved it. But I don't want to talk about that because I'm trying to talk about this.
All right. So go.
So yeah, your life, what is it like?
Yeah. So usually I do 24-hour shifts. Starts at 7:30 in the morning. We go 7:30 a.m. to 7:30 a.m. And it depends. I could have patients right away in the morning. If I don't, I try and nap or just chill. But if I have patients, then I just hand off from the previous provider and we just roll with those patients, either discharge them, transfer them, figure out what's going on, kind of all that stuff. And then my town is small, so that I live in, it's like 10,000, but we have a college in there, so that has all the college students too. So really it's not that many. So in my ER, it's me and one nurse.
Okay.
That's it.
I see.
There's no MD. There's no, it's me.
Oh, so you could do all this fun stuff.
So I do it all.
That's cool.
Yep. And then, so anything that walks through that door, it's my responsibility.
Wow.
If it's a finger that needs sutured, if it's a runny nose, if it's a lady that's in labor, which scares me, but yes.
Well, don't tell our audience that it scares you. I don't think many of our audiences are having children.
Yeah, probably not. No.
Yeah, no. So yeah, it just, anything that walks through that door, that's my job. And then we're hooked up to a hospital and a clinic. So sometimes they have emergencies or questions. And so they're like, call me and they're like, how do we deal with that? Because my job is to make sure you're not going to die today.
Oh, well, that's good. Thanks.
That's a win.
Yes.
Right.
So you talked a little bit about, how you became an ER NP. Like how did you get there? Like what brought you to that point? What was your career path?
So got my BSN. And then I got the opportunity to be in a cardiac specialty hospital. So that's all I did. So I did telemetry, which is like a step down unit. And then I did cardiac ICU. So I was a nurse for a total of 6 years before I was a nurse practitioner.
Okay.
A little bit over 6 years. But yeah, so in the height of my RN career, my job was to, if a patient had open heart surgery, they came to me right afterward. Okay. So they were intubated, they had drips going, they whole 9 yards. That was my job. Or if you all of a sudden, if you see somebody arrest, out in the public,
right.
They're like, oh my gosh, start CPR, all of that. Right. And they're like, we got him back. But they aren't moving. They came to me and I dealt with all of that.
Right. Okay.
So very sick individuals.
Sure.
And so very adrenaline filled, high stakes, but
okay.
I loved it.
Okay, so you use some lingo that maybe I'm not always familiar with, but I figured it out, and you said drips.
Yeah.
So as soon as I hear something, I'll try to ask you what that means so we can clarify for people.
Totally.
I mean, I get it, a drip makes sense,
Yeah.
but just in case something comes up, I'm like, what did she say?
Oh, yeah.
I don't know what that is. That might happen.
So yeah, drips, medications. If we have to do medications in your IV.
Sure.
Continuously. Okay. So either if you need medications to help keep you asleep, because we don't want you to wake up with whatever you have going on, or medications to keep your blood pressure up or down, depending on what's going on with your body. Pain medications, all of it.
Can I get some of that to help me sleep every night?
That would be the Michael Jackson drug, and that's kind of illegal.
So that would be no, Brian.
No, shoot. Okay. Well, check that off the list.
Right. All right. So I want to stick on the ICU just for a couple of minutes because I obviously have known you for a while.
And you've heard some of my stories.
I've heard some of your stories. And so tell me about, you're cardiac nurse. You've dealt with open, hearts. You in your presence, an open heart.
Yeah.
How cool is that?
Seeing a heart beating in a chest.
Yeah.
Open.
Yeah.
Yeah.
Oh, that's just amazing to
Did
me.
you ever have put your hands in there and massage it?
No, but we did almost have to, and we were all like, well, okay, this is how we do that.
Okay, like nervous, or okay, like who gets to get in there?
Like both.
Okay.
To be like, all right, we need sterile gloves when we do this. Okay, what's your sterile glove size? Okay, put that on the desk. Okay, what's right there? All right. Okay, if this goes down, they're right there. Okay. But yeah, like
That's awesome.
If sometimes in open heart surgery, there's complications with any kind of surgery, sometimes they can't close the chest cavity like they normally do. So they actually have to leave it open. And then so your heart and everything is just sitting there. You can see it plain as day. But they wrap it up in a sterile drape is kind of the easy, or the sterile, it looks like saran wrap, kind of.
Okay.
But it's all sterile. It's to keep it all protected, but you can see the heart beating.
Cool.
That's cool. That's cool. So how was that? Because this was a while ago, so you were there during COVID. How was that for you?
That was brutal.
Why? Tell us more.
So my hospital was separate from the main campus. So we were considered the clean hospital, but we were their cardiac unit. So any kind of patients with any kind of chest pain, any cardiac issue, they came to us. And so usually we got the sick of the sick because COVID, as we know, has many complications that can happen. And then we also have the vascular unit. So if you had blood clots in your legs, blood clots in your lungs, things like that from COVID, you came to us too. I remember one of the first patients, we didn't know if she had COVID or not, but she was intubated, everything, and we were suspecting she had COVID. This is when it took 4 or 5 days to get that confirmation.
Okay. So early on.
Yes. So if you thought that they had COVID, you tested them, they had to be in isolation until you had that test approved that they were not COVID positive. So we had to be full pappers. I don't know if I've ever showed you a picture of me in a full papper.
What's a papper?
So it's a full, like, kind of looks like a little hazmat suit.
Awesome.
So yeah. So
wow.
I have like, you have specific gown, gloves, like boots on your feet.
Yeah.
You have a specific like apparatus. So like you belt it, it's a belt, and then it blows air into a hood that you wear.
Oh, because I was just going to ask, is it hot in those?
Actually, no, it's actually better to be in those because you don't have to wear a mask.
That would be, that's
So that you actually wanted to be in a papper because you could be without a mask. Because then you got the cool air in there.
Yeah,
and it's like,
and masks get hot.
it did, but that in the
But
COVID,
that's the way it is.
Yep.
Life, that's life.
I lived in that for 2 or 3 years.
Yeah, ick. Okay, so next question. When should someone actually go to the ER versus urgent care?
Okay, so do you know the difference between urgent care and ER?
I do not know the difference between urgent care and ER. Well, I mean, I assumed ER is like really emergencies, but I don't know.
Okay, because I feel like a lot of people don't actually know the difference.
Right, like me.
Yeah. So urgent care can be in your local clinic. Like your family providers can totally be urgent care. They can have urgent care hours, things like that, where they just do walk-ins where like, hey, I think I sprained my ankle. I need to be seen. Like that kind of stuff.
I cut my finger.
Yep, totally. Like that would be like an urgent care thing. So
check these nodules on my throat.
yeah. My sore throat for a couple days, all of that. You think you have a urinary tract infection, earaches, like some minor cuts, minor burns, that kind of thing. They can totally suture you up. They can deal with all of that. Same with like minor broken bones, minor being like it's not sticking out.
Oh, sure. Okay, well, yeah, I guess if I saw my bone sticking out, first of all, am I conscious? I don't know. But I'd probably be like, okay, that's an ER visit.
Yeah. Yep.
Yeah.
I don't think I'm saying it that calmly.
You'd be surprised. You'd be surprised the amount of people that come in very calm and you're like, so you're going to see a lot of people really quick here because you are very, very sick. But like back pain, asthma attacks, like nausea, vomiting, those are all things that can, or like rashes. I get rashes sometimes in the ER and I'm like, that's usually not an emergency unless it couples with like a fever of 105.
Right.
But
Well, and is it after urgent care hours?
that too, because there's limitations. So sometimes then
Yeah.
people just have to go to the ER because that's all they have.
Right.
But those are the things that you would go to urgent care for. ER, I would say like fevers above 104. Or if you have like little kiddos, then that threshold changes. Like newborns, like kids less than 1, then that changes. But typically for the most population, 104. If you get above that, you're like, okay, we probably need to go get checked out.
Yeah, that sounds bad.
Yeah. Yeah. But like if you have seizures, if you have like suicidal thoughts with like intent to harm yourself, things like that, definitely like the ER is the place to go because we can get you into a safe spot.
Right.
and make sure you're not going to do anything. Any like concern for like a stroke. So that is like slurred speech, one-sided like weakness where you're like, my left arm and my left leg aren't working. It's dragging. Like that's not normal.
Is this normal?
Shouldn't look like this. Or like you have that slurred speech or things like that.
I always have slurred speech. So I've been working on that since, when did we start this podcast?
We're what is episode 39 now, so
Yeah, I'm trying real hard.
there you go.
Well, we can do an NIH stroke scale on you. I can tell you.
Yes, please do. And also, my hand goes numb all the time.
It's because you're sitting on it. Stop.
Oh, shit. That's it. Okay, you were saying?
But yes, like any head trauma, let's say you fell, you hit your head, you lost consciousness, now you're like vomiting and somebody looks at you and you're like, one pupil's this like huge size and one's like really tiny. That's not a good thing. Definitely you need to be seen.
Okay.
Any like
Well, this is helpful.
right?
Yeah.
Like severe abdominal pain, like any kind of pain, but like please try something first. Like
Like, what do you mean, please try something?
so like people come in all the time and they're like, well, this hurts. I'm like, well, have you tried Tylenol, ibuprofen, heat, ice? Have you tried
Oh,
like
see, I thought you were
know,
going to ask me to go poop.
that too. Because the amount of times that people come in with abdominal pain, I'm like, when did you poop last? And they're like, 3 days ago. I'm like, how about you poop?
Might be a problem.
And I do this whole huge workup and I'll CT scan you and everything. And I'm like, you're FOS,
What?
which is
What is that?
full of shit. It's a medical term,
No,
okay?
Is it really? You guys say that?
Oh, yeah.
Oh, that's awesome.
Oh, yeah. Depending on the rapport I have with my patients, I'll walk in and I'll be like, you're FOS. And they're like, oh my God, like, what is that? And I'm like, full of shit.
Okay, so take that in context. So she does work in a college town with lots of college kids.
Right.
Yes.
Right. So
Yes. So, but yes. Oh, vomiting blood, not good.
No, I
Please
wouldn't
come in.
imagine vomiting
yeah,
blood's good.
that sounds
Yeah.
bad.
No.
I don't think that's ever good.
Yeah. Or like I said, like major broken bones if it's sticking out.
Okay, that's gross. Okay.
Oh, I've seen that.
Yeah, I've seen that on TV.
TV.
Yeah. So speaking of TV, I mean, I know you're kind of a TV fan.
Yes.
You watch a lot of TV medical shows, right? Mm-hmm. What's your favorite right now?
The Pit.
Right?
Oh, The Pit is the best.
Is that show
We're
the best?
watching it
Yeah,
later.
yeah, I know we are. Yeah. Is it relatively realistic? I mean, what myths are on there and kind of what makes you laugh the hardest?
I feel like it's very realistic. It's just not all of that happens in one day. So they're condensing what probably happens like in days to months in that kind of setting into like one day. You're not going to get all of those patients.
Right.
But still, like it's very realistic, especially like the first season was very realistic when they had one patient and like it was a grandpa and like the kids didn't want to let him go. So they wanted to do all this invasive stuff. And like the
Yeah.
doc is just trying to really teach them and educate. And they just going through that grieving process with those patients and be like, yeah, that's kind of how we have to do it. And,
Right.
and then when they did the MASH casualty, we're like, that is definitely how it goes. We're like all hands on deck, like everybody like get in there, whatever you need to do, you do.
Mm-hmm.
And then when, I can't remember his name. One of the guys just throws an IO, which is that one with the gun, the IV with the gun, right in that guy's shoulder, and he was awake.
Okay.
Yeah, you don't usually do that.
No. So a couple of things maybe are not necessarily correct.
You
But
can, not advise because it does hurt, but you can.
I had heard that they had to go through a 2-week training course for that show so they could actually learn to do things correctly.
Correct.
And have the real settings be, all the settings around it be real.
Yep.
Yeah. That was fascinating to me.
Brian, Noah Wiley's been a doctor on TV for like 30 some years. I think he knows what he's doing at this point.
Yeah, but I don't know. Was ER, the show ER, as good as The Pit?
That's their different eras, but they're still amazing.
Yeah.
Okay.
I think yes. It's the same creator, by the way, for both of them.
Yes.
So there's that.
Okay.
So I'm going to say yes
All right.
because I think it's that good.
Yeah.
Okay, so what is maybe the strangest or weirdest experience you had with a patient?
Well, recently, we had a patient walk in. I can't even remember what his complaint was. So walked in, he was in the ER room. We walked in, we're like, God, that smells weird. And he's like, oh yeah, I poopsied in my pants.
No.
And we're like,
No way.
yep. And he was like completely with it, knew exactly what was going on. And we're like,
He wasn't there for another reason.
no.
He just was there for
Well,
whatever reason he was
so
there for.
I couldn't remember it because it was like, this was just like the thing that I remember about it. I'm like, that is no.
And he just crapped his pants.
Yep.
That's
Didn't walk to the bathroom, didn't ask to go to the bathroom, just like was sitting on the stretcher and
so
just...
like that just happens, huh? That's really weird. First of
yeah.
all, my worst nightmare, I poop my pants somewhere.
Oh, yeah.
Because what are you gonna do? I'm full of shit now. I don't know.
Yeah.
Figuratively and literally.
Exactly.
Full of shit.
Full of shit.
Oh, yeah.
Hey, Brian, I was just outside trying to enjoy the yard, and the mosquitoes are driving me nuts.
Oh, you got to call Spring Green for that, Rob.
Spring Green? I thought they just did my fertilizer and weed control.
Oh, they do that, and our lawn looks amazing because of it. But their mosquito control is a game changer. We can actually use our patio. You know how bad the state bird gets in Minnesota.
I'm pretty sure that's the loon, but point taken. So they do lawns and mosquitoes?
And total home pest control. My house is completely mouse-free. They even do liquid aerations and lawn insect control.
Wow, I'm only using them for half of what I could be.
You should fix that. Go to spring-green.com and get a personalized quote today.
That's spring-green.com.
And tell them Owen One More Thing sent you.
Okay, we're back. So, Nikki, what's the most adrenaline-filled moment you've ever experienced on the job?
Is this going to be good?
Good for me because like the medical field, if they were listening, they'd be like, yeah, that's definitely like not what we want to hear. Like when you hear over the like EMS like calling you.
Sure.
Like, I don't know. It just depends. Like, especially being in the ER, like you never know what's coming through those doors. I could have like an unresponsive kid, I could have like anything, but the one that sticks out to me one of the most is I had a page out, my EMS, like a different EMS crew, not my local crew, from a smaller town was coming in. They were calling me and they're like, hey, we have this report for this patient you're gonna get. I'm like, okay, cool. I was brand new, like right off orientation. I was like, okay, this is all right. We got
first one. This is great.
This is great. And it's Sunday morning, so it's literally me, my nurse, and one other nurse in the hospital. That's all that's in this building, other than a secretary down in the clinic. That's it.
Okay, it's
Like-
a light day.
Like that's actually pretty typical.
Okay.
On like Saturday, Sunday. Like, that's it. So all of a sudden I get this call and this like crew is going, they're kind of talking fast. I'm like, okay, like they're just a little nervous, whatevs, it's okay. Went through their whole spiel, took about 5 minutes for them to tell me about all this. And they're like, oh, by the way, CPR is in progress. And I'm like, say what? I'm like, you're doing what in there? And they're like, yeah, CPR in progress. And we're a BLS crew, so we have nothing.
What do you mean they have nothing? What does that
So
mean?
BLS crew means they can only do CPR. And like bag them with a bag valves mask. They can't intubate, meaning they can't put a breathing tube in. They can't put IVs in. They can't push meds. They can't do anything. So literally, they're just pounding on this lady's chest, running or like driving as fast as they can to the ER.
Wow.
And I'm like,
and you're waiting there at the ER, like
right?
adrenaline just building up.
Yep. I have me, my nurse, she's like 4'10", so she's tiny, and it's me and her. And then my other nurse. Okay, I have no CRNA to help me intubate. I have like nothing. And I'm like, okay, we can do this. We can do this.
You got this.
That was probably one of the...
Okay, so now let's find out. Did she make it?
No.
Oh, well, that was sad.
Wah, wah.
Wah, wah. Sorry about that. I don't mean to be mean.
The rate of actually getting somebody back in the field is not actually very good.
So it's not like on TV? Where they all magically come back to life?
No, not at all. And that it's sad, but it's just the way the human body works.
How long would you do CPR before you call the time of death?
And that's a very hard question to ask because I get a lot of students who ask me that question.
Okay.
It depends on how long they were down before you started CPR.
Sure.
What interventions you were able to do kind of right away. Like were you able to intubate them, get them breaths, like do compressions, like all of this stuff, get them meds. And then it depends what took them down. So was it a heart attack? Was it a blood clot in their lungs? Like what took them down? Like what caused that arrest? Because ultimately that has to be fixed. And if we can't fix that, then...
And you have a very short window.
Yeah,
right?
you do. It's not very long before your brain starts not getting enough oxygen, and that's really when we're looking at like calling it not continuing CPR. Is we might get them back. I might get their heart beating again after 30 minutes, but their brain is fried.
Yeah,
their brain has not gotten enough oxygen, so there's no set time. My shortest code was like 7 minutes, and my longest code was 65 minutes. Just because
you worked on that person for 65 minutes because the
family wanted
signs
me
looked
to.
good. Oh.
Yep.
It was more than just the signs of...
The signs were not good, But my job in that situation, especially if the family's present, is to educate them and be like, this is what I'm seeing. These are the signs of life I'm not seeing. This is not good. Like if I get her back or whoever back, they're not going to be them. They're not going to sit there and laugh at you. They're not going to remember your name. They're going to be a vegetable.
Okay.
So do you really want that for your loved one? And sometimes like people have had that conversation with their family and they're like, no, they don't want to live like that. Please stop. And others are like, no, I'm not ready. And we continue for as long as I'm like, okay, now we're eating up resources that I really can't be eating up anymore. We gotta stop.
So I'm asking these questions basically because I watch medical TV shows and I'm trying to think about what do they do on TV that I can ask a real person. What is maybe the funniest coping mechanism that you've seen among your ER staff?
Our
in
humor.
general?
We have very dark humor.
Oh, that's dark.
We have very morbid and dark humor because that's how we cope with our situations. They're very stressful. We see a lot of stuff that the general population doesn't.
Okay.
And so that's just how we cope, is we figure out ways to laugh about things and just, that's how we cope.
Okay.
Like one thing, do you know what DC to JC is?
I do not. Do tell.
So DC, discharge.
Okay.
So that's the acronym for discharge. To JC, Jesus Christ.
Wait.
So if you hear
DC
somebody say
to JC.
DC to JC, they need a DC to JC, or they are going to DC to JC.
Oh my gosh, that's not amazing at all, but that's funny to me.
See, it's and that's just like the tip of the iceberg. But that's kind of our humor. Like we have some people call it the fifth presser, which is so we have just so many medications to help with blood pressure, like keep it up. That in really bad situations, we have just so many that really work. We call it the fifth presser. So we have it sitting in, actually right next to me when I work, we have a little shelf or a drawer, and he's sitting next to me as a little syringe. It's Jesus Christ. He's about this big. He's a little toy, and he sits in a syringe with some water. So we have holy water, and so, because he's in there, so technically it's holy.
Sure.
So he's the fifth presser. In case we've tried everything else, we'll set him in the room and pray.
Have you ever seen Dogma?
Yes.
I'm getting you a Buddy Christ for sure.
Yes.
Right on your desk. That's awesome. What's one thing you wish every patient understood before they came to the ER?
That our job is to make sure you're not dying, to get you good enough to you need to follow up with specialties, PCPs, that kind of stuff. I might not find out exactly what's wrong with you. I'll make sure you're not going to die today.
Right.
Or in the next couple of days. But my job is not necessarily to diagnose every little thing. Yeah. It's to be like, I think you have this going on. I need you to see a cardiologist, or hey, I need you to see a neurologist because I think this is what's going on. I need you to see this specialty.
Right.
So you might not get all the answers you want going into an ER, because I know some people do, and they're like, well, I've had this for this many years. I've seen this many specialists. Why can't you figure this out? I'm like, well, yeah, that's not kind of what I'm there for.
All right.
And then also, it's not a first come, first serve. It's based on acuity. And acuity means how sick you are. So if you have somebody who comes in, they're like, yeah, I'm coughing. I've had this cough for a couple days. I want to be seen. Okay, cool. I have somebody who just walked in with chest pain. That chest painer is going to get into that door a lot quicker than your cough. Yeah. And that's what people don't understand when they're sitting in that waiting room and they're like, these 3 people went ahead of me. How dare you? All that stuff. And it's no, it's not that we're ignoring you. It's based off of what your symptoms are. You're less of a, not priority, but you're lower on the totem pole than the other people based on what they're complaining about.
Well, I call priority. If somebody's bleeding out, I think I'd want to take care of that first before somebody who has a nagging cough,
Correct.
Yeah.
But you'd be surprised how many people will, so we have double doors to get into our ER. They're both locked because you can't just walk into an ER because that's a safety issue.
Right.
So you have to pick up a phone and you have to tell us what you want to be seen for. We'll let you into the waiting room, and then there's another door you have to get in to get into the actual ER that's locked as well.
Yeah.
The amount of people that will be like, okay, take a seat, we'll come get you in a little bit. The amount of people that will walk through that first door and then come banging on that second door and say, well, I want to be seen in the ER now. And we're like, yeah, that's not how that works.
Yeah. Go sit down.
Yeah.
Yeah.
So that we're not ignoring you. It's just based off of what your complaint is. I might have a full ER and I don't have a room for you, or I have a patient that's sicker than you that I'm dealing with. So that's what a lot of people don't quite get.
Okay, people, please pay attention.
Just a little bit. I know you're in pain, or I know you're not feeling good, but situational awareness a little bit.
So what do you think is the most difficult part about being in ER&P?
Either not finding the answer when patients come in and they're like, hey, this is going on, and you do all the scans, you do all the labs, and I'm like, they all look good. Like I'm not quite sure what's causing
you can't
this.
Get to the real root of whatever
and it sucks because we like being detectives. We like being like, oh, okay, let's figure this out. Like,
okay.
But when you don't find that, it's kind of disappointing to be like, I've done everything I can think of.
That was a cool analogy you just said right there. Detective.
Yeah.
So you're a detective in the sense of that illness or that medical situation.
Yep.
Just like a cop is looking for the guy who shot the guy,
Yep.
and you're taking care of the guy who got shot.
Yes.
It's all circular.
It is. Wow. Mind blown.
Because we ask a lot of questions, and some people get frustrated with that, but we ask those questions because that helps us figure out what pathways to take.
Sure.
To be like, if you're complaining of this but not this, I'm less suspicious of this going on. I'm more suspicious of this. So it's kind of like if you think of like a tree, like you have to figure out which branches to follow and which not down to figure out what is that root cause. And then kind of along those lines are those patient expectations, because people walk in and they want those answers or things like that. Or if I had to give worst case scenario things as well, which really suck. Like I had to give a patient, she came in because her abdomen hurt, and we thought, oh yeah, this sounds very much like your gallbladder. This is definitely your gallbladder. Sure, Let's scan you. We'll get you figured out. You probably have to see a surgeon. That's a very straightforward kind of thing. Scanned her. She had stage 4 cancer. She had cancer all over, and she didn't know.
No idea.
So I had to go in there and be like, so it is your gallbladder, but it's also your liver, your pancreas, your spleen.
So you delivered the news.
I have to. Yeah, because she had to go to a higher level of care, but I was the one who scanned her. I was the one that found it. I have to tell her that in order for her to prepare to be like, I need to go see these specialists now.
Sure.
Right.
So that is never an easy conversation.
No, it's not.
All right. So the best part about working in the ER, crazy stories. You have to have some.
Oh, I have one of my favorites is living in a college town. College kids do crazy stuff.
What? No.
Right?
Right?
So this guy haven't met him since, but I'm like, lucky. So what was happening? He was drunk. He was making, surprise.
No good decisions.
Doesn't every college kid story start with he was drunk or she was drunk?
Making pizza rolls in a glass bowl. And I guess there was something on the floor that he tripped and fell. The bowl fell. He landed on the bowl, but it had shattered. He was naked for some reason, making these pizza rolls.
Well, that makes sense, right?
Right? Like 3 a.m. naked, making pizza rolls in a glass bowl. Sounds legit.
Doesn't everybody?
That sound like last weekend?
Right? That's a Thursday.
So cut his butt wide open.
Oh, God.
And didn't even realize it because he was that drunk. Went to bed in the living room on an air mattress, and his roommates came home a couple hours later and like, oh my God, it's a bloodbath in here.
Blood everywhere?
Yep. So they called 911, everything. They brought him in, and he had a laceration, like almost the span of his butt cheek.
Well, it's been bleeding for how long? I mean,
But there's no arteries back there. Like, not big ones, so you're fine. Like, you're not going to bleed out.
So you lost a little blood, but not all your blood.
Not all your blood, but...
Now, is there a certain window of time, like I've always seen on TV, that you can't sew it back together?
Yeah, usually you want to sew it back together within 24 hours.
Oh, okay.
So...
I thought it was less than that.
Preferably, if we can do it within 12, that would be great. But some people
That's ruin it for me.
Right. Preferably, I got put a hip back in place the other day.
What?
Yeah,
Really?
a hip dislocated.
Okay.
So
Yeah.
what did you have to do? You have to push on it really hard or something?
Actually, it's called the captain. So the layman's term, we call it Captain Morgan's technique.
Okay. What does that mean?
You know how Captain Morgan, he puts his foot up on a barrel?
Sure. Okay.
That's exactly what you do. So what you do is you put your foot, so your foot is on the stretcher. And
Okay.
you like a barrel, so it's like 90-degree angle kind of thing. And
Okay.
you put their leg with the dislocated hip over your leg, use it as like a pivot or like a hinge. And then you have two people hold the sides of their hips, and then you pull that leg over your leg until that hip goes back into place.
Okay, that sounds like it hurts.
The patient's unconscious.
Oh.
We knock you out for
'cause
that.
I would say that's not comfortable at all.
That's gotta hurt.
You get good pain meds, but I knew the premise of how to do it, but I've actually never done it. And so when in rural medicine,
Oh, well, good for you, right?
In rural medicine, we just kind of have to figure it out. So I had to YouTube it before I did it.
Really?
Yes. I'm like, I know I've read it. I've this, but
all
I'm
right,
like,
everybody, just hold here. I'm going to watch this YouTube video.
oh, the amount of times we've actually done that.
Oh
Yes.
my God. Do you know all the WebMD people that are just loving you right now? Like, oh, I self-diagnose all the time.
Yeah, no. Like if you know what you're looking for, that's the thing.
Right.
And I'm like, I know how to, like, I've read about this technique. I know it works. I'm just like, how, like, I want to watch somebody do it.
So you do it right the first time.
Yes. So
Just like all of the repairs I do in my bathroom.
it's fine.
My plumbing.
Yep.
Do it right
Plumbing.
the first time.
There you go.
And the wife
I don't know
was,
why I went there.
Plumbing,
Yeah.
Plumbing.
it ties together.
Sort of.
Sort of.
but the wife was asking me the whole time. She's like, have you, like, where's the specialist? Have you done this before? Like, oh my gosh, where's the specialist? And she was just freaking out. And finally I looked at her. I had a student, not a student. She was training with me. I finally looked at her. I'm like, well, before this, my nurse had gone in the room to get vitals and everything like that. And he was a guy. And she's like, oh my gosh, is that the doctor? And I'm like, no, that's the nurse. Thanks. I'm the nurse practitioner. I'm in charge here. That's my nurse. Thanks.
And you've done this hundreds of times.
I know. And she's like, oh, have you done this before? I'm like, yes.
While you're shaking your head.
Yeah. Yeah. And if I was like, this is real medicine, we're going to figure it out. We'll do what we got to do. And she actually wrote us a letter, like when they got home and they sent it to us. We're like, oh, that's so great.
That's nice.
You
Oh, that's
remembered
nice.
us. You want another story?
Oh, yeah.
Yes, please.
Keep the stories coming. This is awesome.
So I had another patient. I was coming on shift and I can see on my phone, I have an app that I can see like the chart before I come in. So I can kind of prepare myself to be like, oh, hey, yep, like these are the labs. This is kind of what I'm walking into before I start my shift. Usually I do it like 30 minutes before. And so I was watching this
Occupational
patient,
hazard, reading before you work.
right? Just to be like,
Yep. Got
I need to mentally prepare.
Yep.
How much coffee or how much like, what do I need to bring?
some Red Bulls.
Yep. Oh, Red Bull infusions from Scooters. Yes. I have walked in with the extra large before, and one of my MDs has looked at me and he's like, and I'm like, I need it.
Yeah.
Just leave me be.
Exactly.
But so I'm like, oh yeah, this lady's sick. Like she's sick. Hopefully we're getting her out. Like, are we working on transfer? And so I walk in and my provider I'm trading out with is with a different patient, and my nurse is running around in this patient room, and I look in her room and I'm like, she's a highlighter. Like she looks like a highlighter, which means you have like acute liver failure.
Highlighter like you're yellow.
Yep.
Your skin is
Like
yellow.
your skin is like yellow like a highlighter.
Okay. Well, that's not good.
No, you should not be that color.
You shouldn't be yellow.
Do not advise that as your color of choice. Especially if it's your eyes, like your nail beds, everything is that color.
I'm looking at my nail beds right now.
Right. Should
Not
be-
yellow.
Not yellow, not purple either.
Not purple.
No.
Nice, lightly pink.
Aw.
I'm healthy, sort of.
Well, as far as you know.
And anyway, continue with your story. As I so rudely interrupted.
So not great. And all of a sudden I'm looking at the vitals and I'm like, our pressures are kind of low. And my nurse is hanging fluids and I'm like, I'm going to go order some more meds for you, like some blood pressure medications, because this is not looking good. And I'm like, okay. So finally the provider that I'm handing off with, and I'm like, so have we called somebody to get her out? Like, this is not good. And at this point, I was training again, and she's a PA. She came in too, and I'm like, hey, she had not seen this kind of patient before. I'm like, go assess this patient. I'm going to throw some more orders in, go check this patient. So she went and did her physical exam, and she walks out and she's like, was there blood under the patient earlier? And this provider's like, well, she has her period. And she's like, this is not period blood. So I walk in there and like we lift up the sheet. She's sitting in a pool of her own blood.
Oh.
So liver failure, your liver controls a lot of your clotting factors. So if
Okay.
your liver is crap, you're not going to clot. So you're just going to bleed.
Oh.
So she was bleeding out, and that's why her pressures were crap. And we're
Okay,
like,
well, that's gross.
yeah. So we're like, So we moved her to trauma, did a whole bunch of stuff, but we're just like, she just lifted up the sheet and we're like, this is why your blood pressure's low. You have no blood.
Oh.
That's an adrenaline like. So I didn't know if I would like suturing just because I had never done it as a nurse. Like that just wasn't in my scope. And it's just something.
So what? Sewing up a cut, a big old gash? That's
Everything, all of it. Yep. So and there's different ways to suture. There's different techniques, things like that. And so just learning all those, and it's just a technique. It's just how your hands move, how you hold the needle, everything like that. It's just a very technical kind of thing.
Okay.
But it's all muscle memory once you get it down.
Sure.
Then you can just like go to town and you can just start suturing like sewing kind
Sure.
of thing, except it's just human skin.
Well, that's all.
Right?
It's not a big deal.
Not a big deal.
Didn't you practice on pigs when you were going to school?
No.
What did you practice on?
So we actually bought like kits off Amazon you can buy, and it's like fake skin.
Oh, okay.
But you can do it on pigs or like bananas. Sure. Bananas work too. And then you just like the skin that we got did different gashes, like different sizes, different like if it was jagged, if it was deep, that kind of stuff, and we could practice our different sutures on that.
Okay, gotcha.
So we didn't just practice on people; we practiced on non-people.
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 Well,
as
I would hope you would previously practice before you go to a person.
But remember, I did the hip on a person for the first time.
Yeah, that's true.
So,
which sounded cool.
It is what it is.
Right. Okay.
Eventually, you just got to do it. I actually do really like suturing, and I've actually got some compliments on my sutures because I'm like, haha.
Aww.
Oh, really?
So yeah,
awesome.
Because they have to follow up, and like the providers that I know, they're like, yeah, this looks really good. It came together nice. I'm like, okay, good, because I wasn't sure. I had this guy come in. His mom picks up the phone, freaking out at the front, and she's like, my son, he's like in his 20s or 30s, was trying to cut down like a little sapling or like a small tree with a chainsaw. The chainsaw slipped, and he got his leg. And I'm like, oh crap. I'm like expecting like his leg to be like half off, and I'm like, great. This is great. So we get him into the room, and his whole leg is just wrapped in this towel. So I unwrap it, and he had cut down. He was lucky. The chainsaw went down his leg, but it missed the bone. So it was just in the meat.
Okay.
So I had to...
Great term.
That still got hurt.
He looked at it, and he was ready to pass out. And I'm like, don't look at it. Stop looking at it.
But now, wouldn't a chainsaw make that kind of a jagged...
It does. It makes it very jagged because it's not a knife. Yeah. So
a clean cut.
Yeah, no. So to suture it took me over an hour.
Okay.
But it was...
How deep was it?
So I did 2 layers of sutures. So you can
one
have...
inside.
One inside, and so that'll dissolve over weeks to months. So that'll stay there. And then the top side you cut off, like anywhere from like 10 days to 14 days. But his stayed longer just because of how jagged it was. Oh. So I had to do 2 layers of sutures to get that to close.
Wow.
And over an hour.
So how do you choose, I guess I'm probably answering my own question as I asked this. How do you choose between like if you're going to staple or you're going to suture?
Depends on the location.
Okay.
So like if it's on your like head, like if you were to like bonk the top of your head, I'd just staple the top of your head.
Okay.
Easy peasy.
When do we get to see that?
Get my head stapled? There's not a lot of hair there. It'd be easy to see.
Yeah.
This is where I was going, but I didn't want to say it out loud.
Thank you.
You know I'm nice.
Yeah. So a lot of it is like location. Like where are you? Where's the injury? That will just staple it. Because really your hairline, like, well, not yours, but somebody else's.
There's still a hairline. It's just very thin.
Like,
okay.
Shut up.
So let's say you've got this big gash in your leg and it's all jagged, like you say. Is the guy out for this, or is he just local anesthetic so he can't feel it?
Local, so he can't feel it.
But he can watch.
Oh, yeah.
Awesome.
Yeah. So I've had patients that like they want to watch. So actually that reminds me. So I had a patient, he smashed his thumb in a metal door.
Yeah.
And he was only Spanish speaking. So I had the interpreter on the line the whole time, and I'm like trying to figure out how to suture this close, because it was like, so if you ever like smashed anything and it like kind of looks like splits wide open.
Yeah.
So that's what his finger did.
Okay.
So it was like, it looked like a Y, kind of how it like split open. So I'm like trying to figure out how to suture this, and I'm like talking to him through the interpreter and everything. And finally, do you know the meme? Is it from Family Guy or or one of them is like, do you feel bonita? Because you look bonita. So that's all I could think about, because that's all I know in Spanish. And so I just looked at his finger and I'm like, I'm trying to make it bonita. And he's just like laughing at me. And I'm like, I'm trying, man. I'm trying, man.
Yeah. That's awesome.
We need to teach you how to use Google Translate.
I had a translator, okay?
Your phone is Google Translate.
I know, but
It's
medical.
Awesome. Yeah,
Albano. But yeah, but then I did see a broken bone outside of the body.
Ew.
Yeah. When did that happen?
That was a couple months ago. Summer. This little kiddo, I think she was like on the playground, fell, and the way that she fell, she like landed just right. She broke one of the bones in her arm and dislocated the other, but the bone that broke popped out of her arm. So mom came running in, holding this kid's arm, just trying to hold it as straight as she can with this bone sticking out.
Right.
And so this kid's screaming, mom's
crazy.
Mom's crying because kid's hurt, and I'm just like, okay.
You're like, that looks fascinating.
I'm like, that looks like it hurts.
Let's give you some drugs.
I'm like, how do I make this a little bit better? And you definitely need to go somewhere else. I'm like,
you didn't put that one back in?
No. I do like putting bones back though. That's actually pretty fun too. If somebody has like a broken ankle, things like that, that's actually pretty fun.
So if it's somewhat, it's not sticking out of the skin, you can like, what do you pull on it if it's a leg and try to reset it?
Yeah, it depends on the joint or it depends on like where it's at.
Yeah.
So a lot of the times you have to pull traction. So meaning like, let's say you broke your ankle. I have like my nurse or somebody hanging onto your knee and I am yanking on your ankle. I'm pulling it towards me because I'm at the foot of the bed to try and get those bones to align enough. And it depending on where the break is, sometimes I'm pushing on one side of your ankle to try and get that to like set.
Pop in.
Yep. And you can feel it crunch the whole time.
Gross. Okay. So I'm asking this because hello, I watch television and it's all true to me. So I have to ask these questions.
God, it's on the internet. It's true.
Come on, Rob. I think we've had this podcast before. Did. Okay. So you got one more story for us?
I do. So like drunk college kids again.
No, they don't make great stories.
Right. Of course, just like high school, college has like homecoming, like things like that, all of those special weekends, whatever. Sometimes when they get rowdy, or like college kids, they have a lot of stress. They have a lot of anxiety. They need mental health help. So sometimes the cops will pick them up and take them where they need to go and that kind of stuff. So one night I was busy, like it was one of their weekends where, they're partying, all of that. I was a full ER and all of a sudden the cops pull in to my ambulance bay and usually they don't do that. And what dispatch had called me, they're like, hey, we need to medically clearance this patient because they're going to go to jail. We just need to make sure they're medically cleared to do that.
Okay.
So that's just to make sure that they're not going to like pass out or die in the jail cell while they're sobering up or things like that.
Right. That'd be bad.
Yeah. So we call it like medical clearance. So I go out and they're like, but they're not going to bring the patient in. You have to go out to them. And I'm like, okay, I'm busy, but okay. So I walk out and here's these 3 cops standing outside this cop car. And I hear this patient screaming their head off, kicking the door. And they're like,
oh no.
Yeah. So we're not getting them out. Obviously they're like that. Here's a flashlight. We'll open up the front of the door to the cop car and you can go talk to them and medically clear them. And I'm like, if you 3 grown men are not wanting to go near this patient, why do you think I want to go near I'm like, they're screaming and they're moving everything and kicking stuff. I feel like they're fine.
Yeah, they're still breathing.
Yep, they're obviously breathing. They're obviously moving. You can take them.
Right.
I'm good. I don't need to get any closer.
Right. Oh gosh, that's crazy.
But I was just like, you guys don't want to go near them and you have tasers. Why do I want to go near them?
That's funny.
Like, no.
So did you ever pull anything out of a butt?
No. I don't want to. If you're going to do that, whatever your preference is, I don't care. But flared base, people. Flared base.
Because why?
Because it's just like the way the like rectum and everything works, it'll just like suction it all up in there. So, flared base.
Oh my
then
gosh.
it doesn't get sucked up in there. Then you can take it out.
Okay, maybe that's a little bit too much.
So many things I don't need to know.
Right. Apparently, though, you need to know flared base.
Flared base.
If you
that's
remember nothing else, flared base.
Flared base.
Exactly. To all of our listeners, flared base.
Our podcast, it's the one thing they're going to remember.
Flared base.
Flared base. That's a win.
That's crazy.
Okay, so being a health professional, what are some things that people of our age, middle life, what can we do to stay healthy?
Just like diet and exercise, and not like diet.
Really?
Hang on.
That's the worst.
Nobody wants
Nikki.
that.
The worst.
Not like the crazy diets where you're like, I can only eat 3 leaves of salad a day.
Right.
And like this
I think
grape.
I've been on that diet.
No, you clearly have not.
Hey! Are you calling me fat?
Not your face.
Oh, that's right. You're Minnesota nice. I forgot.
That's right.
Like not that kind of diet, but just like moderation. Be like,
Sure.
Like watch what you're eating, balanced diet. A lot of the times like Mediterranean diet works very well for people just because it has that a lot of balance and variety in it. So you can do the leaner meats like fish and chicken and stuff. But in the Midwest, it's kind of hard because we like our beef and our steak.
Yep.
So.
And our 4th meal, Taco Bell?
Yep.
I do watch what I eat. I watch it go in.
Yeah. You have the seafood diet?
I have the seafood diet.
Yeah.
That's right.
So a lot of it's just like moderation. Like you don't need the crazy fad diets and everything to make it work. And then just exercise. Again, you don't need to go lifting weights for 2 hours every day Like, it's 30 minutes a day, so many times a week, 3 to 4 times a week. That's what you need.
Okay.
Like, you just need to get up and move.
Get up and move.
So go for a walk 3 or 4 days a week, Brian.
Or
do VR boxing.
No. Again, not going to do it. Well, this has been great having you on. It's so fun to hear all these stories that I don't get a part of.
Right? Yeah. Thanks for hanging out with us. It was fun.
Totally. Yeah. I know you hear all the stories.
I hear all the stories, but they're so fun. Yeah. Hey, everyone, as always, please follow us on the socials at and One More Thing Pod on Facebook and Instagram for highlights and news of our upcoming shows.
And if you have any show ideas for us or just want to give us some feedback, send us an email at onemoreThingPod@gmail.com. We'd love to hear from you.
Plus, we have some awesome merchandise, t-shirts and caps. Nikki's wearing a beautiful t-shirt right now. You should all have one on.
That's amazing.
If you're interested, just send us an email.
That'd be cool. Oh, one more thing, Rob.
What's that?
The next time you have to go to the ER, remember, be honest, be calm, and don't Google your symptoms while waiting. You may arrive with a sprained ankle, but convince yourself you have a rare 18th century disease.
That's so true.
So bring your patience, bring your ID, and bring your sense of humor. Because the wait may be long, the chairs are uncomfortable, and the vending machine will absolutely judge you for buying Skittles at 3 a.m.
That's what it does.
Yep, absolutely.
All right.
Bye, everyone.
Bye. Wait, you meant to say Reese's Pieces, right?
Absolutely, I meant to say Reese's Pieces.